Yo, what's happening? Again, it's Jay Reed, Chief of the League, Keep It Sun Cloud. I'm here with my sons, Jeff and Amarion. We're going to go with the next two phases of our Urban Lifesavers Course. Okay? So today, fellas, what we're going to go over real fast is check for breathing, rescue breathing, in case they're not breathing. After you check them out, to figure out how you can get them to start breathing. Alright? Then after that, we'll go into open chest wound. Alright? If a person gets shot in the chest or a person gets stabbed in the chest, we're going to see how we identify the symptoms of an open chest wound. Then we're going to see what we need to do, how we're going to check for the open chest wound. Then we'll see how we need to seal a chest wound, because that thing needs to be sealed as well. Alright, secure it and position it, and those will be the two classes that we're going to do today. Okay, so the first thing we're going to do, we're going to check for breathing. When you check for breathing, you run across a person. If they're obviously talking or whatever, then you know, okay, they're conscious. Right. So these are the next steps from the ones that we went over already. We checked their consciousness, and then we went back and we checked for we put the tourniquet on and things like that. This is only a couple minutes. Continuing on with your process, now you're checking for breathing. All right, and when somebody's unconscious, what's going to happen is their tongue tends to relax and slip back in the back of their mouth. So you got to be conscious of that. You're going to have to use what's called a head tilt chin lift method. So for this, we're actually going to have to switch the cameras. Now we want to go ahead and check for breathing. What we're going to do is get down and kneel right beside the person. All right, kneel up beside at their shoulder levels. And once you kneel at their shoulder level, you put one hand on the forehead. Because now what you want to do, you're going to lift their head back. It's called the head tilt chin lift, okay? So you're going to take one hand and you're going to put it on the forehead. You're going to start pressing back slightly. You're going to take these two fingers, you're going to push that head back, and you pull that chin forward like that. Now you got the head position like you need to do. You want the mouth to be slightly open. Now what you want to do is you're going to put your face down right above their nose, okay? And once you put your face down above their nose, you're able to see down their chest, and you can see if it rises or falls, and you should be able to feel them breathing on the side of your face, okay? Those are the things that you're looking for. If you don't feel those things, then something's wrong. So if you don't feel those things, immediately when you look, you need to figure out, is their throat like closed up or something blocking their throat? Maybe the tongue slid back, because when you're unconscious, remember I told you your tongue will slide back. So you need to go in, and then you'll clear their throat or do whatever. Now we're not going to do that right here for practicing purposes, because nobody wants nobody's hands in their freaking mouth. You cleared the mouth, you make sure you took out you moved their tongue, or you got anything out the way that might be cleared, blocking the airway, then you go down and you do it again. You see if they're breathing. They're not breathing. Now you want to check their pulse before you go into a process of giving rescue breathing. You check for the pulse, you're going to take your two fingers, and you're going to reach for the carotid artery, which is by the jawbone. You don't want to use this finger because you got your own pulse that you'll feel. So kind of if you feel on yourself, you'll be able to feel the beat of your heart. Like right here, I feel it real good, okay? So I'm going to feel right down here. And you can feel that. So if they have a pulse, then you're going. If they don't have a pulse and they're not breathing, you assume, you're figuring, okay, they're not alive. So you're going to check and make sure if they have a pulse, then you're going to go ahead and you're going to rescue breathing. You're going to blow air into their lungs, all right? So you're going to blow one breath of air into their lungs every 5 seconds, which is going to mimic breathing, okay? And how you're going to do this, you're going to have to pinch their nostrils close together. And I'm not going to blow any air into his mouth, okay? So when you're out in the street, you're probably not just going to do this for anybody, right? Okay, but if your mom goes down, your sister, your brother, or whatever, and that's why it's always good to be brushing y'all teeth, because if you ever fall down and somebody got to choose to save your life, they might want to make sure your breath is all right. You see what I'm saying? Okay, well, we're going to go on. So you want to gently pinch their mouth, and then you'll open up the mouth and make a seal with your mouth and theirs. You don't have to put your tongue in their mouth or nothing like this. So once you do it, you're gonna have your nose pinched again. You bent down, and when you blow that breath in there, you're gonna look for the chest to rise to see is the air going in there. Okay, and then once it does, when you let the nose go, you should feel that air come out. Okay, and you should do one of those once every 5 seconds, so about 12 a minute. Continue to do that and check it every 1 minute. You're gonna check the pulse or whatever. There's also, you can do compressions in between those rescue breathing. You're gonna take the palm of your hand here, you're gonna put in the middle of that chest, and then you're gonna take this other hand behind it. You're gonna stand up. You're gonna be up above them. You can straight down, 2.5 to 3 inches. Just okay. And those are the compressors.
Yeah, I went through my I did all that stuff. I repositioned my victim, and now we're here. I have to check him, see if he's breathing. The first thing you want to do is check the pulse first. You're using these two, so sometimes I get these two and these two confused, but you need to make sure that you're using your middle finger and I guess ring finger.
Why not your pointer finger?
Because your pointer finger, it has like its own beat. So now you want to put one hand right here on the forehead, and then the same two fingers right under the chin. So forehead tilt, chin lift.
You are and go in that order, and then you'll be good to go. Right? Tilt the forehead first. Right.
So push the forehead back, tilt it. You want to be a little hard, but not too hard. Open the mouth a little bit. Alright, make sure it's open. Now you're gonna get right here. What I'm doing right here is like seeing if his chest is going up and down.
Now you didn't feel it. You don't feel any breath or anything like that. What do you need to do?
You just make sure nothing's in his mouth, and then.
So if it is, then what are you gonna do?
You're gonna clear his mouth.
Okay.
Alright, so as you did that, you check to see if everything's good, everything's clear. You want to, I'm not gonna physically do it, but you want to make sure that his mouth is already open. Just blow air into his mouth. Before you do that, plug his nose, and make sure, you always have to make sure that his mouth's open, and then just blow air into his mouth.
You want to create a seal and blow air, and then.
So you do that like every 5 seconds. Should be like 12 times.
Okay.
In a minute, and then between those, like every 5 seconds, you want to perform compressions. All right. So put one hand down. Put your palm right here, right in the middle.
The balls of your palm.
And then, like, lock it, sure that it's real tight, and then you start to push down. And you can't be scared to push down hard, because it's saving a life.
So how far are you pushing down?
And you're pushing down like 2 to 3 inches.
Okay. And how many?
Like 100.
At the rate of about 100 per minute. So then now you've done that, and you've done that for about a minute. What do you need to do now?
Check his pulse.
And then you continue to rescue breathing until medical people come. Until the point to where he doesn't have a pulse anymore, and you've tried a couple of times. Because you'll die from the lack of blood quicker than you will from the lack of air. Alright, so you make sure that that's still going. If there's no blood moving, no matter if you blowing air into them, they're not going to come back. Again, this is an injury that we lose a lot of people out here in the streets. People get stabbed, take a gunshot wound in their chest, and then all of a sudden